like a class 3, but it extends to the inside of the ledge. And usually these occur in clinical situations from a traumatic fall or some sort of bonk that chips the front tooth. So we'll go on the clinical situations later, but let's try to concentrate just on doing the lab part of it today. So one of the things in any lab situation is making sure you have everything you need out. So I'm going to kind of go over that real quickly. Number one, planning for success. This is one of my favorite books. We've got some available in the clinic. Just ask your block instructor or first year lead where you can find these, but these are awesome. These are for actually wax carvings, but they have really beautiful pictures of the teeth and kind of what you're trying to achieve. One of the things I want to point out is that in making this restoration, the back of the tooth has what's called a cingulum, and then on the sides of there, it's almost like a marginal ridge in a class 2 restoration. So you're making kind of a little bit of a shovel shape. So we want to maintain this ridge on the mesial part of the tooth, so we'd be right in this area here. And this is, the whole depression here is called the cingulum. So we're going to have kind of a cupped out shovel shape lingual, okay? And then on the facial, we've got more of a convexity. You may have these little grooves here called mamelons. When you're a kid, you have pretty predominant mamelons, and then as your teeth come into occlusion, they usually wear down to have a nice smooth edge. But sometimes you will have a little depression in here, and you got to allow for that when you do your restoration. Looking at it from the incisal ledge, you can see that again, it has kind of a shovel shape to it, and then you've got literally kind of like a marginal ridge on either side there, and then your cingulum. So you'll be dealing with kind of this mesial aspect right up in here. You got some side shots. I think they're kind of handy to think about that too. But I think it's kind of a good idea to kind of get an idea what you're striving to achieve. Okay. Also, I just want to go over a couple things. You're going to be using a slow speed handpiece and a high speed handpiece. These are from the clinic. But just know that like on your slow speed, you get an adapter that does not have a hole in the top of it. That's the slow speed adapter. Make sure everything's joined together firmly. Doesn't have to be super tightened, but firm. This is a high speed adapter. It has a light that will go up in those two little things there, kind of like headlights to the handpiece. There's also high speed adapters that have a hole in the top of them. They look a lot like this, but they have a hole in the top there. So those are your high speed adapters. So I've seen sometimes where we've put in swapped them out wrong, especially these small little guys. Sometimes you got like a slow speed and a high speed, and you're wondering why it's not working or it's not blowing air or something like that. So make sure you get the right components put together. You'll have a glass slab, or with your issue, you've got your mixing pad. This is kind of a basic setup of probably what you have for armamentarium. So you have a blue-gray brush for polishing. We've got tapered flame, blunted flame, football. You probably won't need that. That's the number 2 round, and that's the mandrel for your disc. Okay. You will need some floss to check your contact and stuff. You'll do your curing light. I would suggest that you have your interproximal strips, your plastic, and your in small and large, and then short or smaller diameter disc and a metal interproximal strip. And I know that's fearful, but that's helpful as well. And then you'll need I call it a carrot, but it's your large wedge, and then a mylar strip, much smaller than that. We'll probably cut that down into thirds when we start using them. So that's all of that. Also, you've got your composite, and that should be A4. I grabbed C4 so you can hopefully see it as we place this today. One thing you might notice that on your preps, sometimes the length of the prep may be too far. So you can see over here, these guys are pretty much, just a little stair step to the central incisor. But on this side, it jumps up pretty good. So ask your block instructor to lower that for you, so we can make sure it gets, you're starting with an appropriate height. So lastly, I borrowed the clinic's instruments, but you'll need, your mirrors, your explorer. This is called a plastic instrument, something flat to place the composite. You'll need maybe a Hollenbeck, I don't know, maybe. Cone burnisher and ball burnisher. Okay, and it'd probably be good to have some cotton forceps and your crown bridge scissors for cutting your mylar strips. So in a clinical situation with patients, I'm just kind of pointing out that these are all items I don't really need, so they can go off to the side. If you want to, keep an orderly procedure, make sure that you keep most of the stuff that you need on the right-hand side and stuff that you're probably not going to need at least immediately on the left-hand side. Okay, so I'm going to make a couple adjustments to my restoration or my prep tooth, and then we'll get going. All right. All right. Well, I have sped things up because after looking at the video that I made, it's about an hour long. So I have doubled the speed, and I will do a commentary as we go. So what I'm talking about here is the potential of using, and the rationale from using a rubber dam. I'm pointing to a W2 clamp that can be used around a premolar, and the reason why I'm recommending a rubber dam is to prevent saliva or contamination of your prep. It's also easier to work in the long run. It's a little bit more work in the front end, but it'll make things a lot easier in the long run. One of the other things that you're preventing is potential getting any materials that you use, like chemicals that could cause a reaction, either allergic or a burn from etch. So usually I fold my rubber dam up in quarters, and then that will make a, if you snap it in the middle, it makes a little bullseye in the middle, so that's what I'm talking about there, so I can punch things properly. Okay, so we want to start in the kind of middle of the rubber dam so that it doesn't pull in one direction or another. Okay, it's good to punch the holes in pairs, so start at your centrals, then your laterals, and then your canines, and then I'm doing one additional punch there for number 5. Okay, we're going to need that W2 clamp on the premolar on number 5. I'm putting a little lasso around the clamp so that it slides easily over the bow of the clamp. Those little holes there are not for your string, or your floss. So I'm putting the rubber dam on, trying to, struggling a little bit because I found that actually using some lubricant, especially on a dentoform, it makes it a lot easier. Sometimes I'll just use saliva from the cheek if it's on a patient, but yeah. So magically it went on once we got all the lubricant on there. You can notice the little ligature on behind the distal of 11, and then we've kind of pushed all the holes down. But one of the tricks I'm going to show here is that we're using a ligature to hold that rubber dam a little bit closer to the gingiva. A lot of times with class 4s and class 3s, they get pretty tight against the gums. So I'm showing you how to tie that there. It's a little slip knot, and then you wrap it around the tooth, okay, and that gets held on the lingual part of the tooth if you have an assistant with a Hollenbeck or a plastic instrument, and then you snug it up underneath the cingulum, and then, so I'm showing with the plastic instrument there to hold it on the lingual, okay, and then snug it up around the tooth, and that will help hold that rubber dam up there taut, and it won't, and also it doesn't allow saliva to seep out from underneath the rubber dam. So it's a little trick that somebody taught me a long time ago. Works really, really, really well. Be happy to show you guys that anytime you want to see it. So pretty good isolation there, actually really good. You will need to do anesthetic to get that clamp around number 5 just a little bit so that they're comfortable with that. Now you've got some good isolation. Alright, Mylar strip. We only need about 1/3 of what you got going on there, so we're going to cut that there about 2 or 3 inches. Okay, we need to get that kind of around the tooth, and you need to kind of pre-shape it in order for it to sit in the sulcus okay. And then we're using the carrot to get that secured down. You want that pretty secure. Okay, it's important to get that in there so it doesn't not like that, but get it snugged in there. Okay, I do talk about this in the original video, that if you're doing this on a patient in clinic, I want you to do your etch and your gluma prior to putting this band on. Make sure you put it on once you do your bonding step, but if you do your etch and your gluma and you're rinsing both of those, you'll probably lose your matrix. That mylar strip will probably go right up your high-speed suction, or it'll knock it loose. So what I'm talking about there is just making sure you do your etch and your gluma, and then secure your matrix, and then do your bond. Even when you cure your bond, make sure you wrap that mylar strip kind of around the tooth or to the shape of the tooth so you don't get any flash that's kind of hanging out there like a hangnail. Okay, now I'm probably talking about the steps as far as placing the composite, but it's about a 3-step process. So you're placing towards the facial of the tooth from the lingual, okay, and then wrapping the mylar strip around the shape of the tooth, okay, and I'm probably going to show you that in a second here. And then you do the second, so there you go, there's wrapping on the facial, and you even want to curve it a little bit on the lingual when you're curing even this facial layer, because if you don't, you'll have this amount of material that's sticking straight out the back of the tooth. Okay, and your second layer will go on the lingual, and then you're wrapping that mylar strip around there again, and then your final layer would be the incisal layer, just right on the tip of the tooth there. I'm sure I'm saying something really important there, but so we're using C4. I'm talking about that first layer of composite there is generally not what you want to use, so I usually kind of cut that off or pinch it off and then get a fresh layer of composite on there so that I'm assured that nothing is like pre-cured or sugary or have a weird texture to start with. Okay, so I'm putting that out on my glass slab there. Okay, about a BB size, and then you use the back side of your ball burnisher, the elbow part of it, to cut it in half, maybe even a quarter. Sometimes you may want to pre-test to see if your small little ball will go into a certain prep. Sometimes the doctors make those pretty challenging to put the material in. So now I'm using the elbow to cut the material in half, and then I think I said that the quarter, it's a little too big, so then I go to a quarter. Okay, I'm pushing from the lingual towards the facial when I place this. And that's where I kind of said, yeah, that's too much composite there. Alright, so we're pushing from the lingual towards the facial, also down towards the gingival as well, to make sure that that cavo-surface margin down on the gingival is sealed up. Okay, we don't do flowable or anything like that, so we've got to make sure that's sealed. So you can tell I'm kind of pushing down a little bit, and I'm pushing forward. And what's going to happen, we're going to pull that mylar strip towards the facial, just like that, and that's what's going to make a really nice contour and also seal it up. And you notice I did that on the back part too, okay, so that you have a pre-curve kind of lingual. If you don't do that, again, you're going to have a straight amount of material sticking straight out the back, and we don't want that. So this is our second layer, okay, and I'm pushing it down on the lingual, okay, kind of getting it up to the side, to that incisal part of the prep. Okay, a little extra on the facial. If you have a little bit of flash, it's okay. We'll deal with that, but we'll try to place it as best that we can. Okay, but you got to look at it from a variety of different angles as you place it. Okay, I'm wrapping around on the facial to extend it, and there you go. So that's going to make a really nice mesial and lingual, the mesial and the facial and the lingual, all the cingulum part of it, so what we're talking about, all the embrasure part of the tooth in a good contour, and something that now we don't need to use a lot of instruments to make that nice facial and lingual embrasure. Okay, so we still got the incisal layer to address. Okay, so I'm going to get some more material, and we'll use probably a plastic instrument to place that on the incisal and basically freehand it. We don't need to wrap anything anymore. It should be okay. So here we are. Looks like I'm still cleaning up the back side of the tooth there. There might have been some voids or something in there. Using the ball burnisher to smooth it out a little bit and make sure everything's nice and flush. Okay, make sure you extend it over to the, you could use a comb burnisher if you wanted to. I preferred the ball in this case, and then pushing that material over towards the mesial, both to make a contact, but also to clean it up. And then I've made a, there you go, holding that mylar strip with the ball burnisher to make a nice lingual embrasure. Okay, but I'm kind of pooching it out just a tad bit, so if you do it, you pull it really taut, you'll take away from your contact. You need to have it kind of pooch out a bit. Okay, ooh, that looks good. Okay, you see that little shiny stuff on the lingual there, not a lot of excess material. That's really important. So this final step, we're going to do the incisal edge. Okay, probably going to freehand it with a plastic instrument. Okay, so tapping it down, making sure it's, you know, flush against cavo surface margins, pushing it towards the incisal, mesial, incisal. Okay, you got the incisal, facial, lingual. Look at it from a variety of different angles with your mirror. There you go. Okay, there you go. I think I probably cured it and then stepped up the video a little bit there, because there's no way I would be able to poke at it without curing it. Okay, so I verified that all my margins are sealed, and I've got, you know, roughly a good place to start. There's not a ton of excess material. It's always better to have a little bit more than a little bit less. Sub is not a good thing. It's not really fixable. Voids in the material is not fixable. But a little bit of extra is not the end of the world. Okay, so I'm checking the cavo surface margins and stuff like that, ensuring that I'm good on the lingual and having a little bit of a concavity on the lingual, and then preserving that kind of the marginal ridge, if you want to think of it that way, of the mesial aspect, mesial lingual aspect of the tooth. Okay. At this point, I've removed the mylar strip and probably going to do some work on the tooth, keeping the wedge in there. Okay, don't take your wedge out right now. You're still wanting to maintain that contact. If you take that wedge out and you start working in approximately on the tooth, you could lose your contact. I'm checking on the facial. Looks like I'm pretty happy with that. The lingual part of it, I think there was a little bit of an overhang on the lingual, a little excess material there. It's just slightly high, which is great. Okay, I'm using the tomatoey disc and a short disc. Okay, and then talking about the other discs, which are more polishing discs. So your peach one and the lemon, those are more polishing. They won't take down very much material. The tomato is kind of like a medium grit, so that's probably perfect. If you had a huge amount of material, and you might want to use the brick, but the brick will also take away a lot of material and potentially damage your tooth as well. So I'm a little bit more comfortable with taking a little bit longer with a tomato than I am a brick. So we're just cleaning things up, starting to kind of make that shovel shape. So it's going to taper down from gingival incisal. So we kind of taking that down and having a kind of a curvature from the gingival to the incisal. Okay, also kind of, again, making that shovel shape, so it's going to taper also kind of down towards that mesial incisal area there. Remember that there are on these teeth a little bit of a mamelon indentation, and right there is what I'm working on there. So you'll have a little bit of flash or poor margin if you don't kind of acknowledge that you've got that depression there. But be real careful with your discs. They can cut down material fast. So your speed should be pretty low. It shouldn't be very high. Okay. Continue to look at it from a variety of different angles as you go. Don't stare at it from only one position, because it'll look great from one position, and then you look at another and you're like, that's not so great. So I'm using a round ball on the lingual. That's a white one. If you had extra material back there, you might want to do a green ball. But so burrs with like a 7404 or a green or a white ball will make it's a convex type of burr, so that'll make a concavity on your tooth, which is what you want. You want the inside of the shovel on the lingual part of the tooth to make that cingulum. If you're working on the facial of the tooth, then you're going to want something flat, like a disc, or if you get really good, you can use like a blunted flame or tapered flame, and sometimes I really like diamonds as well. Those are really sweet. So right now I'm just working on the lingual, kind of going on the incisal a little bit, lowering it down a little bit. The balls are, to start, are pretty good. You can even use them to kind of clean up that marginal ridge and kind of establish the embrasures on the lingual and the facial. Okay. Checking the contact. Yep, we got a contact, and it's not shredding, which is great. It means we probably don't have a layering issue, no voids in between. But also using a metal interproximal strip. This is something not to be afraid of. Just make sure that you wedge your tooth firmly, and I use the back side of the cotton pliers to do that. Okay. Then we're going to use that metal interproximal strip, and in the middle of it there's a point where there's no abrasive in there, and then I'm doing what I call shoe shining it. So you see there's tension on the lingual and the buccal. The neat thing about this, you can adjust where you want it, so you can have it come straight out the facial and lots of tension on the lingual, or vice versa. Just depends on where you want to work on this thing. And then I'm giving it just a little bit of a tension just on the contact point, but not much. Well, I don't know what I'm talking about there. I'm sure it was really important. Okay, still refining things on my discs. working on the facial embrasure a little bit. I removed, so I removed the carrot, as you can tell, because sometimes it's difficult to get the angulation that you want with your disc, so sometimes you got to remove that, but just don't touch anything as far as interproximal when you remove your carrot, otherwise you lose your contact. Okay, so we're just doing lots of finishing here. Gentle, easy, kind of working things around. I'm not staying in one place very long. I'm not using a lot of pressure, not using a lot of speed in my handpiece. If I, hear stuff where somebody's flooring it, or the handpiece is going really fast, I'll probably come over and tell you to lighten up a little bit. We're working on the lingual and incisal area there. Okay. I think I showed that you can use your disc is kind of interchangeable. There we go. So you can use the lingual part of it, or you can flip that around and work it on the facial. So that disc is interchangeable, facial and lingual. Now I'm talking about using, I put that the carrot back in and using a proximal strip. That's a wide one there. I think I determined once I started trying to work on it, like, this isn't working really well, it's too big. Okay, I'm kind of working a little bit on my contact to make sure it's nice and smooth, but I decided to go back to the smaller, more narrow one. I think that's what's in your issue. So we're giving it a little shoe shine, cleaning it up. That's less abrasive by far than your metal one. So we're just cleaning it up. See that kind of shoe shining type of thing there? That's what creates a beautiful embrasure, facial, lingual, gingival, all that kind of stuff. Okay. Now it looks like I'm talking about polishing, because we're pretty close to where we want to be. So we've got the tomato with a little bit of water, and then we got the lemon with a little bit of water. You don't have to do water, but I think it's helpful to create kind of a slurry of the abrasive materials there. And again, low speed, kind of working around, not staying in one place too long. And there's the lemon with water, it appears. Again, you can reverse these if you want to make it smooth on a lingual too. Probably going to go switch to something that'll polish the lingual, so something like a baby, my favorite, the blue. Okay, blue without water, by the way. It does a better job without, because it gets a better grip on your material and smooths things better. Then if you're happy with this, how the appearance with just the blue, you can stop there, but I'm just going through the whole steps to kind of show you some extra stuff there. So the gray is a little bit, not necessarily softer, but it's not as abrasive as the baby blue. We're working that through the embrasure and on the lingual. Then we're going to the brush. The brush definitely needs water. That has some silica material in there, kind of like sand, and so that water helps kind of incorporate that into this slurry that gets on the composite. Okay, talking about the shape of the tooth there, shovel shape, all that. Now I'm talking about something that I really like, and these are more available for clinical use, but they're called enhanced points, and that's an enhanced point, and that's an enhanced disc. I like them a lot working with patients. Okay, so we're pretty darn close here to the final product, but I think what I'm talking about is that when you go to get graded on your restoration, kind of be sure to clean up house and make things look good. Give your instructor a reason to give you a good grade. You just have a big old mess, and it's kind of, you're trying to look for a reason why it looks good. Whereas, my saying is that there's no second chance for a first impression. So dressing it up, cleaning it up, giving your instructor or your board examiner, they just come over and look at it and they're like, wow, that looks great. And they got to search for something to say, to find bad about it. But if it just looks good from the get-go, that really starts you out on the right foot. So here I'm teaching you how to take that little whisker off. So you pull it out and you get a little triangular area. Be careful to not clip the tissue. You want to make sure you get a head and a tail. If you don't see that head and tail when you remove that, then especially people that have deep periodontal pockets, you're going to have to go fishing for it. But you don't want somebody showing up on your doorstep a couple days after doing restoration, have a big old fistula or infection due to leaving something in the gums. So there I removed the ligature from 11, taken off the W2 clamp on 5. I just about tried to take all that off of there without clipping the septums. Probably not the right thing to do. So I'm going through each septum, lifting the material away from the gums, and then clipping it. Okay, and then we can pull it off. Check your rubber dam, make sure you got all your material. And then I see a little piece of green. Yep, so we're getting that out of there, just checking everything. Okay, cleaning things up, probably getting 2x2 to make sure there's no dust and garbage in there. And again, dressing it up. Looks pretty good to me. I'm going to floss it, make sure we got no shredding. Beautiful, nice contact. There you go, look at that. Nice embrasure facial lingually. So that's it. Good luck.